Isang magandang araw, Luzon, Visayas at Mindanao. Magandang araw din po sa ating mga kababayan na nakamonitor po sa episode natin for today. Welcome po. So thank you, Doc. Si Alvin Elchico po ito. Have you ever donated blood in your entire life? Nakadonate na ba kayo kahit minsan man lang? Ako hindi ko na maalala when was the last time na nag-donate ako ng dugo. Healthy po yan. Mag-donate po kayo and you can save lives. Diyan po si sentro ang ating usapan for today. Kasama po natin ang puso ng programang ito, Ate B, Bernadette Sembrano-Aguinaldo. Good morning siya, Ate B.
Ivan, gandang question, no? Ako ay nakapagbigay na pero I hope I could do it more often. Pero ako ay nakatanggap na din ng dugo. Noong baby ako, Vin, naalala ko sinabi ng magulang ko, muntikan akong mamatay nung pinanganak. At ang laking bagay kung sino man yung nagbigay ng dugong yan na hindi ko naman mapapasalamatan, ano? Kayo ba ay nakatanggap din ng dugo? If nakatanggap kayo ng dugo, alam ninyo kung gaano kahalaga yan. Kaya naman yan po ang ating pag-uusapan. Kapiling natin ng eksperto, advokasya rin po niya ang pagbibigay ng dugo. Dr. Amy Flores. Hi, Dr. Amy.
Magandang umaga ulit sa inyo, Sir Alvin and the lovely Bernadette. No?
Ayan.
For having me, I am privileged to be invited to speak about blood donation and even about blood transfusion in this ADS event of yours. Thank you, Doc.
Mag-start po tayo sa blood donation. Sino po ba, sino-sino ang pwedeng mag-donate ng dugo? Yung profile ng blood donor.
Yes. So actually, every Filipino, not even a Filipino, no? Kahit sino po, ay pwedeng magbigay ng dugo. So ano yung mga hinahanap natin para ikaw ay maging eligible magbigay ng dugo? Unang-una, na ikaw ay willing, freely, voluntarily, that you would like to share your blood to save life. No? So medically, we will screen you, and it starts for first you being healthy, at least for the past week, no? Na wala kang na-experience na illness, like a flu, mga symptoms ko umuubos, sana maiwasan natin yan. Second, age. Okay? Meron tayong age range, no? And it starts from 16 to even as high as 60, 65, and even more, no? For those with ages 16 to 18, we need your parental's consent nga lang. Pero pag start ng 18 years of age, freely on your own will, you can donate blood. Okay, ano pa ba? Weight, no? Yan ang kadalasang marami tayong sayang, lalo mga kababaihan at nagda-diet kasi nasa semplang dyan sa criteria na to. Kasi kailangan at least 110 pounds or 50 kilos. No? Para ikaw ay healthy enough or safe enough, I should say, to give blood. Okay? And then ano pa? Blood pressure. Chine-check po namin ang inyong vital signs. So start tayo sa blood pressure. Blood pressure will range between 110 to 140 over 60 to 90. So, yung mga sinasabing, doktora, may alta presyon ako. Nako, hindi kayo lulusot sa akin. I-check ko yan. At kung naman yung sinasabi nyo, hypertension or alta presyon, ay controlled naman. At when we screen you, pasok ka dun sa sinasabi namin blood pressure range na not more than 140. Yung may iba nga, maabot pa nga ng 150, 160. Tapos papahinga lang namin sila. Then okay na. So, ang top limit namin, usually 140 over 90. And of course, yung pagtibok ng puso mo, no? Yung puso mo ay aming kinicheck yan. So, dapat yan within 60 to 100, no? Or less than 100. And then, of course, yung paghinga mo, hindi ka labored breathing, hindi ka nakahapo. Kasi minsan, that would be assigned to us, no? Na baka hindi ka eligible mag-donate ng dugo. Roughly yun. And then when you go through the blood donation process, part of the screening, no, is taking a sample of your blood for hemoglobin determination. And we do it two ways. We have the copper sulfate method, yung drop lang, napapansin niyo yan sa mga Red Cross mobile blood drives namin. The drop yung na-prick mo finger sa isang solution na kulay blue, no? And then dapat yung drop of blood ay babagsak. No, pag yun ay medyo lumulutang, nako, baka you don't have enough hemoglobin to share your blood, no, to the intended recipient. So hindi ka muna ipapasa at that time. But remember, these are all temporary deferrals lang naman.
Parang pagpuyat, bumabagsak yung dugo, di ba? Ganun yun.
Ganun din yun kasi we would not like na puyat kayo. Ideally, we would like you to have at least 6 to 8 hours of sleep. Kasi syempre, remember, whatever blood you will donate, this is a gift, no, of life from you to someone who is in need. And di ba, gusto mo, lagi pag ibibigay tayo ng gift, the best gift that you can give. And the best gift that we can give to someone who needs blood transfusion is your blood that you feel is safe because you are healthy. Yan.
Yung story about hemoglobin, pakipaliwanag nyo nga daw kasi sa ordinaryong tao, once nasugatan ka, may lumabas na dugo, yun na yun. Basta may dugo ako. Hindi po, may composition kasi yung dugo. Diba? Ayun yun, Doc, isa doon sa composition is hemoglobin. Ano ba yun?
Yeah, so yung hemoglobin is part, it's a protein, no, that is found in a red blood cell. So ating dugo, ang dugo po natin, kung kayo ay kukulan po ng dugo, example, gawin na natin yung blood donation, ano? Yun ay isasubject namin sa isang machine called the refrigerated centrifuge. So it's a cold centrifuge that will spin the blood around in that bag.
Mm-hmm.
It will then be divided to the components of the blood. And what are the components of the blood? These are your blood cells, and nangunguna dyan yung red blood cells. Kaya yun ang mapula, no, na nakikita niyo pag dugo at kayo nasugatan, yun ang pula. And in that red blood cells, nandun yung hemoglobin. Yun ang importante natin sana ma-determine. We have a cutoff range of 12.5. Yun ang nag-determine ng copper sulfate. Your properly made up, daily made up copper sulfate would make your blood drop or fall, no, into the bottom of that container easily. It means mataas ang hemoglobin mo. No? More than 12.5 yun. In some blood drives, we even have a machine, no, called a hemoglobinometer. And it gives you really a digital readout on what your hemoglobin level is. So ang laging tina-target namin, it should be 12.5 and above. Yun. Now, the other blood cells, of course, kasama na siya dun sa composition ng blood natin. And another blood cell that is very important, especially now, dengue season, is platelet concentrates, no? Yan ay isang special product. So, yan ay hina-harvest namin from the blood that was drawn from you during a blood donation in our blood banks. No, hindi po natin ginagawa in the field. Okay? And then yun yung platelets na sinisave natin pag may nangailangan ng platelet concentrate, yun ay pinupul natin or binibigay natin in several smaller bags to those who need it. Another important blood product na minsan, alam mo, underutilized actually this dengue season, is the plasma products. Pinangungunahan po yan ng tinatawag natin FFP or fresh frozen plasma. Doktora, fresh frozen. Blood bank kami, sinabi ko sa inyo, di ba? Ipapaikot namin yung bag ng dugo nyo, magse-separate siya into different layers and different components of that blood. Kukunin namin yung medyo dilaw-dilaw, no? Light yellow yun. And it's sparkly. So, and then that is the plasma product. We will then subject it to another set of spinning to give the different plasma components, like I mentioned nga, the FFP. And once we get that, mabilis na yan, ilalagay na yan sa ref. Sa freezer, sorry na ref. Sa freezer, kaya fresh, fast frozen siya, no? Kaya fresh frozen plasma yon. Meron din po tayong cryoprecipitates, cryosupernates, and as other products.
So iba-iba pala, Doc. Iba-iba pala yung component ng dugo, at may iba-iba siyang usage.
Pangangailangan.
Iba-ibang pangangailangan. Sa dengue, ano yung kailangan doon? Platelet?
Dengue naging na natin tradisyon na bumabagsak. Kasi di ba, nung monitor sa dengue, yung platelet count, di ba? So, ang kadalasang naging reflex, sa pag bumagsak yung platelet count, lalo na pag lang below 50 na yan, below 50, ay nagre-request na agad ng mga platelet concentrates. Ngayon, hindi lang naman po platelet counts ang ating nire-request sa ating mga pasyente na may suspetsya na dengue, o lalo na kung may hemorrhagic component of that dengue. Ito naman po ay tawag na coagulation factors, ang protein and activated thromboplastin time or APTT. So PT and APTT. No, medyo mahabang acronym siya. So ino-order po yan ng ating mga doktor at sinusuri natin yung coagulation factors na nilalaman dito sa PT and APTT. Kasi po, alam naman pala natin ngayon sa dengue, bagong update sa dengue, hindi naman platelets lang ang nasa-sacrifice. Actually, ang culprit ay yung coagulation factors. Sila talaga papa-worsen ng sakit na dengue. Okay? And then, so, syempre, kung anong namimiss mo sa katawan mo o kulang sa katawan mo, yun ang ating i-replace. That is why we are shying away in doing whole blood transfusion. We are doing component therapy na ngayon, no? Component transfusion, kung ang na-lose mo, red blood cells, like in anemia, you'll be given
Galing.
blood cells. If you're
Ang
losing,
galing.
coagulation
Kasi-
factors like in dengue, it's going to be the plasma products po.
So, ang maganda sa sinasabi niyo, Doc, parang bini-breakdown, depende sa pangangailangan. So, hindi nasasayang, maraming natutulungan. Parang gano'n.
Mhm. Kaya remember, one donation can save at least three lives.
Galing,
Diba?
galing. And Doc, sige, nabanggit nyo dengue, ano pa yung mga need, no? Aksidente, operasyon, kailangan rin ng dugo niyan. Hindi po ba?
Tama yan. Lalo na if your facility caters to a lot of trauma. And you know, the Philippines, maligalig ang mga Pilipino eh. So, ang dami na aksidente. Okay? So, even yan, minahiwa sa kitchen or in a construction area, minsan mga kailangan ng dugo. And tama po kayo, we need to have the right blood stocks in our facilities, no? The hospitals that you as patients go to. Kasi anytime that you will need blood, we would like na meron kami agaran mabibigay sa inyo ng dugo. Ang dugong nawala sa inyo, no? Ang makakapalit lang rin yan ay dugo. Of course, in the interim, we have first aid measures like fluids, no? Yung parang IV fluids, no? Isasalin sa inyo ng mga doktor. Marami na po tayong strategies for us to manage any blood loss, no? Before having the blood mismo to be transfused to you. Remember, hindi po kasi na-produce sa isang factory ang dugo, no? So no matter minsan fluids ay ibigay ng mga doktor sa inyo, colloids, crystalloids, blood pa rin, human blood, human blood ang ating kailangan. So wala pong paggagaling yun, kundi kayo po, ating mga kababayan.
Doc, balik tayo sa donation. We're going to discuss those matters later, yung transfusion. But tapusin lang natin yung blood donation, Doc. So yung basics, gaano karami po ang pwedeng ma-donate in one sitting? At gaano katagal bago pwede ulit ako mag-donate? Pwede bang every week? Kasi parang nagustuhan ko. At ano yung health implications sa iyo kapag ikaw ay donor? 3 questions yun, Doc. Go ahead.
Okay. So let's go first to the first question. Now, blood donation. There are actually 2 kinds of blood donation, There is your conventional blood donation. Yun yung na-experience natin ngayon, halos every day. There are several blood donation drives that go around the country requesting people to donate blood. And those like people like Bernadette, no? You are regular donors na. You come and even ask for blood to be bled, no? So, that's what we call conventional blood donation, whole blood donation. Now, we also have the apheresis or apheresis donation. Yun naman is a special kind of donation that is usually conducted in a blood center. Pero meron na po kami portable version na nadadala rin namin sa mobile blood drives or mobile blood donation. No, yung apheresis machine. Yun naman, ang usually hina-harvest is the component, yung napag-usapan natin kanina. Kunyari, kailangan lang ng red blood cell. Yun lang po ang aming i-harvest sa inyo. Kung kailangan lang platelets, no, yun lang po i-harvest sa inyo. Ganun, or plasma. So there's 2 kinds, no, of blood donation. Gaano kadami? Depending ako sa type. Doon sa conventional whole blood donation, we usually bleed you for around 450 milliliters or cc, sabi ka nila noon, of blood. So ano yon? Halos kalahating galon, no? Or kalahating litro, not galon. Kalahating litro po yung dugong yon. Hindi po yan masyadong madami. Diyos ko, in 10 minutes time, tapos ka na. No? Hindi nakahalata minsan ng mga blood donors, ay, finish na pala. Yun na po yung 450 nyo.
Doc, sorry makabatin, hindi siya ganun karami dahil kung tutuusin, sa buong katawan ng isang tao, gaano karaming litro ng dugo ba ang nasa buong katawan ko?
Yes, so sa isang tao, we have roughly 4.5 to 5 liters of blood. And that 5 liters of blood, yes, we have the red blood cells and the plasma, which is mainly water. And so, out of the 5 liters, di ba, kalahating litro lang po ang aming hihingin sa inyo para makasalba ng
And nagre-replenish.
Yes.
Oo. So that would answer your question. Kailan pa ako next
Number three, yeah.
Yeah, usually in 3 months' time. In some facilities pa nga, if you are really an avid religious regular blood donor, we can bleed you as early as 2.5 weeks. So 2 weeks earlier.
2.5
Oh,
weeks.
wow.
Apo, so but roughly yung regular conventional timing natin is 3 months, as early as 3 months.
So if you lose if you lose half a liter of blood, it will take you 2.5 weeks to get that back. Yung nawalang kalahating litro na binigay ko sa'yo, mababalik yung kalahating litro niyan sa akin 2.5 linggo. Tama?
Yes po, roughly. May mga earlier pa. And why is this? Remember, the main component of our blood, ano sabi ko nga, di ba? The red blood cells, right? Okay. The lifespan of a red blood cell, we call that red blood cell doublet. Okay, because we have a book about this. So, this red blood cell has a lifespan of 120 days. And 120 days is 3 months. So, parang pag nag-donate tayong dugo, sinustimulate po natin ang ating mga bone marrow to replenish what has lost. Kasi, let's say, every day yan, no? And many times a day, our blood is producing, our bone marrows are producing these red blood cells. So, kapag tinanggal sa'yo ang red blood cell, may another naman pong mabubuhay na magli-live sa'yo for another 3 months. But of course, that lifespan of 3 months is the safe parang range for one person to give blood and allow that person to recover, no, from that half a liter blood loss.
So healthy ang mag-donate ng dog. Hindi ka maapektuhan. Hindi maapektuhan yung overall health mo pag nawawalan ka ng dugo every so often.
Yes, in fact, blood donation is part of a healthy lifestyle. When you donate blood, there are lots of benefits in donating blood. Okay, so ano po yan? Pinaka number 1 is that nakasalba ka ng buhay. Nagdugtong ka ng another day for a patient. Okay?
That's right.
Second, medically, it stimulates your bone marrow to produce more red blood cells. No? And that, with that, also, part rin ng hemoglobin kanina, dudugtong ko lang, is what we call iron. No? Yun ang importante rin na nasa katawan natin. And too much iron is not good for the body. Too much iron is even seen to have be part of cancer, no, generation. So kapag regulate natin yung iron stores natin sa body, nami-minimize rin natin ang pagkakaroon ng cancer.
Ganun.
Yung importante. When you donate blood, you burn calories. You burn as much as 200, as low as 200 and as much as 650 calories. Imagine. So, depende sa blood donation activity mo. Malaki rin ang lose mong calories, no? So, para ka nagmi-mini exercise in a way. Ano ba yan, diba? Tapos, pa yun, whenever you go to a blood donation, para ka rin nami-mini check-up, no? May doktor doon. I-check up ka. So, and then tinitest yung blood mo. And remember, we test, maybe not on the spot, we test them back in the blood centers or blood banks with additional functions, are 5 diseases. Kasi there's a law called RA 7719, otherwise known as the Blood Services Act of 1994, which mandatorily tests for 5 transfusion transmissible infections. And these are HIV, or the human immunodeficiency virus, hepatitis B, which is still quite prevalent here in the Philippines, hepatitis C, okay, syphilis, and the last one, malaria. Sometimes we need to test for Zika, or not too often now, CMV. No? So, by law, it is important that we test for these 5 TTIs.
So nagkakalibreng test na yung tao. Pero sinasabi nyo ba doon sa donor na, oy, may sakit ka dito sa 5 ito?
Actually, we do that. We call it counseling. No? Once na after you donate blood, not really on that site, no? Kasi we do this nga in our facilities, our blood service facility, no? When we test for it, you will receive a message or a call. Habang pa lang naman donation, i-inform na kayo na we will test for this kasi kasama siya sa informed consent na pipirmahan niyo dun sa blood donor health questionnaire. So nandun yun. So aware ka na that you may be called. But if you live a healthy lifestyle, you need not worry about this, right? Diba?
Pero ang maganda, Doc, what I'm saying is at least may benefit din. Kahit papaano, kahit nagbigay ka, malalaman mong meron ka ibang sakit, nalalaman mo rin yung blood type mo, di ba? Kasama rin yun, Doc.
Kasama din po yun. I do not emphasize much on blood typing because we shy away on doing blood typing on the spot.
So ano naman yung health risk din? Siguro doon sa magbibigay muna ng dugo, kapag ikaw ay nagbigay ng dugo, delikado rin ba?
Okay. Of course, in anything we do, there is some risk. But in blood donation, the risk is very minimal. Okay, why? Number one, of course, who do we ask for to donate blood? Healthy people, right? So, pag ang premise ay healthy ka, less ang chances mo to develop any, let's say, adverse effects or complications of the blood donation. And what are these? No? Kasi kung hindi prepared yung blood donor mo, katulad yung binanggit natin kanina, talking about kailangan you have good rest of 6 to 8 hours. You did not have any alcohol intake for the past 24 hours. No? You minimize smoking for at least the day before or in the morning before. Ganyan. Had a light snack, mga ganyan, just before blood donation, 2 hours before blood donation. Then, mamiminimise natin yung mga adverse events, no? Of blood donation, which are commonly dizziness. Bakit? Kasi ang ating mga blood donors, medyo naiinip na, no? Madali lang, may kinat lang talaga yung pag-donate ng blood ngayon. Pero minsan may nagmamadali pa din. So, bumabangon sila. Siyempre, biro mo, kahit ka naman kalahating litro yun na tinanggal sa'yo, you need to let your body rest, relax, no? Papakainin pa nga namin kayo no? Replenish that before you really stand up, move about, or even do any strenuous activities which we would refrain you from doing after the blood donation.
What about yung type, natanong na ni Ate B kanina about the typing. So far, sa mga Pilipino, alin po doon yung marami tayong supply? Kasi ang problema natin po kasi, Doc, di ba, hindi naman lahat ng dugo pwede sa lahat ng tao. We really have to segregate it based on type. Kasi di ba pag halimbawa B ako, B plus yung dugo ko Sinalinan ako ni Ate B na O or A or AB. Di ba hindi naman pwede yun? Kailangan swak na B plus ako, B plus din dapat yung ilagay sa akin pag nagkaroon ako ng emergency.
Okay, ideally gusto natin type specific. Yung sinasabi mo kung B ka, B sanang masalin sa'yo, no? Pero in emergency of cases, we have the type O. Remember, 4 blood types yan. A, B, AB, and type O. And type O is what we call a universal blood type. Universal because that's the most common blood type you have. The least common is the AB. Ako po ay AB. Kaya sabi na mga royal blood daw. Okay, so now type O now is considered as the universal red cell donor. So meaning in emergency of cases, walang available na type B, Sir Alvin, at nangailangan ka, pwedeng isalin ang type ni Bernadette na sa iyo. Okay, pero red cell.
Walang repercussion, Doc. Wala namang side effects.
Minimal naman. Alam mo, even blood transfusion has its side effects or risk. That's why we have to outweigh the risk versus the benefits. If it's sabi ko kasi emergency yan So meaning, it's beneficial for you to obtain blood. The best, not best, no? The best blood would be the same blood type, but if the unusual available namin is type O, red cells would be your universal red cell donor for you. Now, if you need plasma, the universal plasma donor now is what? The blood type AB. Kasi plasma lang ang kailangan mo na walang antibodies for A antigen or B antigen ng red cell. Okay? Pero sabi ko nga, ideally, type specific. Kung B ka, B sana may bigay namin sa'yo. Pero kunyari, napunta ka sa amin at wala ako, meron ako O lang. Yung O red cells ang bibigay namin sa'yo.
Doc, bakit may mga negative nakalagay sa driver's license ko? For example, in my case, it's B, tama, di ba? Pero may plus siya. Plus yung iba naman B, pero may negative naman. O A, may negative, may positive. Does it matter? O wag na nating problemahin yun bilang ordinaryong citizen?
No, hinahanap rin po namin yan. Why? Lalo na ngayon, noong unang panahon kasi, halos 95% of the population is RH positive. So, hindi na masyado kinoconsider yung RH. Kaya minsan, pag nagba-blood type kami sa field, wala rin yung anti-D kasi mas mahal. Hindi mas mahal. Kasi nga, hindi na masyado kinukonsider. Kasi generally, Filipinos are RH positive. However, in the past decades, we have a lot of migration and marriages in different races. Now, we have a lot of, not a lot, we have siguro increasing na RH negatives.
Doc, eto, saan magdo-donate? Naka-centralize na ba yung ano? At saan pwedeng kumuha ng dugo? Sana centralized na nga kasi minsan ang dami-dami. Di ba?
Yeah. Okay, ngayon lalo na, no, meron na tayong presidential directive na hindi na po problemahin sana ng pasyente or relatives niya ang paghahagilap ng dugo na to. Lahat ng ating hospital, medical facilities, we call the blood service facilities, have to have certain blood stocks in them. So, para ang ating mga relatives na hindi na kung saan sa pupunta. Now, having it centralized, yes po, we are now centralizing the blood services of the Philippines. And we have a network, no, for this. Now, for the government side, we have the Philippine Blood Center, which is near, no, in the complex of Lung Center. Okay? And then each region has a regional blood center.
Maraming salamat.
It is an honor to have been a guest for you on this topic.
Nakulitin natin, patawagan namin ulit kayo. Yung gusto ko naman yung blood matching. Yung, di ba may nagsasabi, pag ganito yung type ng dugo mo, naku, hindi ka pwedeng mag-asawa ng ganitong type ng dugo. Pag may combination yung dugo, may hindi magandang combination.
Sa baby.
No? May mga ganon. Blood. Meron ba ganon, Doc, o wala? Blood combination.
Hindi. Yan mga kasama natin, lagyan natin sa mga myths and misconception topic. Di ba?
Pwede. Sige.
Pwede.
Yes,
Very good. Tawagan namin ulit kayo, ha?
You can have babies.
Okay. Thank you, Dr. Aimee.
Welcome.
Salamat, Ate B.
Dr. Ed Unson, pag-uusapan po natin ang fur care ng ating mga fur baby sa vet ko yan. Hi, Doc Ed. Magandang umaga.
Magandang umaga sa inyo lahat. Good to be
Welcome
back.
Okay, tapos si Doc Partner. Isang invite mo lang, nandyan ka agad. Talagang napaka-committed.
Maraming makakatulong dito.
Super busy yan, partner. Ang dami-daming kliyente ni Doc Ed. Siya ang pinaka-hinahanap doon sa kanyang The Animal House. Pero he still takes time to guest on our show. Thank you very much, Dr. Ed Unson, and of course sa The Animal House. Doc, ang daming mga ganyan, common yung mga skin diseases na tinutubuan sila ng mga sakit-sakit sa balat. Ano ba yan usually nire-refer sa inyo? May categories ba yan? Or lahat yan pare-pareho lang? Galis yan?
Well, the word galis has become the generic word of may sugat. No? So they'll say may galis yan. But the most common concern with pet owners, nangangati po sila. There's a lot of scratching going on. So makita nila, Doc, kamot ng kamot yung pet ko. Walang tigil yung pet. So ano ba yung problema? Hindi ako nakakatulog, tapos may garapata ba siya, may pulgas. In the recent years, kasi may mga control ngayon para sa garapata. Garapata and pulgas has been the #1 concern. But now with the recent years of oral tablets na binibigay buwan-buwan, ticks and fleas have become, I think, of the past. No? Before, garapata, sobra. Pagpasok sa clinic, panay garapata yan. And the problem is they'll say galis because may garapata o may pulgas. Ngayon, yung main concern, nangangati sila. Kamot ng kamot, wala na sa garapata, nagbibigay ng mga shampoo, maganda na yung mga pagkain nila, pero kamot ng kamot. So that's the biggest concern I see in the vet clinic now. A lot of owners will say, parang miserable yung pet ko kasi kamot siya ng kamot ng kamot, tapos parang nakakalbo siya. So, that's a concern.
Sila kamot ng kamot. So, I guess, Doc, yun yung nakakasama sa kanila, yung pagkakamot. Kasi yun yung nai-infect, yung sugat. Oo.
Yeah. So, you'll have to see.
What causes it?
When you think of itch, which is kamot sa Tagalog, the medical word is pruritus. Okay. So, when you'll see, ano ba yung concern ng pet? Nangangati ba siya? Or, kinakagat ba niya yung balat niya or hindi nangangati? Kasi may kalbo na hindi makati at saka may may mukhang kalbo yung balat, pero makating-makati. Okay. So may mga questions muna. Nangangati ba yung aso o hindi niya pinapansin yung balat niya? Yung nalalagas lang yung buhok or nakakalbo? So again, those are the biggest concern. No? So kung nangangati, we have to ask first, ganong kadalas ang pagkati niya or pagkalbot?
Okay.
No? Madalas
Yung
ba?
binanggit natin, Sige,
On
Doc,
a scale
tapusin mo.
of
Madalas ba?
Yeah, kung 5 meaning kalahati lang, no? Meaning nakakatulog siya, nakakakain, naglalakad siya, hindi siya titigil para magkamot, no? So, pag mataas yung scale niya, ibig sabihin, nagigising yung dog para kamot ng kamot.
Yes.
And
yes.
means, yung katabi niya sa kama, yung may-ari, or sino yung nag-aalaga, hindi makakatulog kasi kamot ng kamot yung pet sa gabi.
Okay.
Or kung natutulog.
Yeah.
Yung
So
isa,
kung may sugat sa dog,
yes.
kung may sugat po yung dogs or cats, what do you do? Anong suggestion mo? Pwede bang pahiran ng mga ointment nyo dyan sa bahay? Or hindi, may sariling gamot yan eh.
Okay. Number 1 is always to check kung ano ang kung may nakatira, kung maraming nakakapit sa balat.
May
no?
parasite.
Especially garapata or pulgas. Okay. Garapata again is ticks. Yan parang crab or parang pasas. There's the male and the female. And the pulgas or the flea looks like an ant, pero mabilis yan. So you can't really see it because they run very fast. So you have to see.
Nakakatakbo. Hindi siya
Mabilis
yung nakakapit sa fur.
Hindi nakakapit yan, ha? Mabilis yan.
Okay.
Mabilis
So one
magagad.
problem area could be fleas.
Always
Yes.
check fleas.
Oo.
Fleas is the most common. Okay.
Maganda
Eh,
yun
kung
kasi
hindi?
parang Oo.
Yeah. Kung saan
hindi,
Kung hindi flea,
Okay. The other one also is flea or tick. Number 2, it might be a fungus. Okay. Fungus dapat ma-diagnose ng veterinary po yan. Pero may mga classic signs like a fungal lesion, they call that ringworm. Ringworm, classic is red, circular, mukhang ring siya, no? Makita mo all over the body. Also, the owner will get, makita mo sa yung may-ari or whoever sleeps with the pet, may mga bagong lesion sa katawan. May pula. Okay. So those are the things that you'll have to look for. Okay, and the third also is, ano bang pinapakain natin sa pet natin? Kasi minsan, may bagong something new na, kunwari may bagong cold cuts or mga pinapakain, bacon. These are the number of the foods that can be allergic are cold cuts, processed foods. Yung iba hindi sanay sa isda. Okay, so other pets are okay with fish. Most pets don't like fish pero nangangati sila sa isda.
Okay.
So you'll have to ask, ano ba yung may bago siyang na-introduce? May nahulog ba sa floor? Meron ba siyang ninakaw na pagkain? Because those are the things that can cause.
So, napansin ko kay Uni, kapag nangangati siya, napansin ko may matting yung pag may buhol.
Yes.
So, ang gagawin ko, sinusuklay ko. So, parang naiirita siya pag may buhol.
Yes.
Alam ko matting is not good no? Kailangan walang ganun. Bakit nga ba?
Okay, matting means that there is something underlying, no? So the oil glands or the apocrine glands are may lumalabas na follicle, no? Na exudate. They call that discharge. Okay. So may makati. That's why they scratch. Okay. Pag may lumabas sa mga glands nila, nagdidikit na yung hair. And hair, pag pinabayaan yan, hindi nasuklayan yan, especially long-haired, when they keep scratching, nagdidikit yan. Because the gland keeps secreting more. And usually that's bacteria. So nagdidikit yan. And it becomes, natatakpan yan. So the underlying skin is still itchy, pero makapal na yung balat, yung buhok, kasi natakpan na, nagdikit-dikit na yan. So when there's something itchy, always investigate. Kasi pag natabunan na yan ng mga mats, wala na, hindi mo makikita yan.
Doc, I have a question naman. Kasi nababanggit natin, fur care, skin care. ano ba dapat ang itsura ng fur ng ating fur baby? One doctor that I spoke with sabi, kung shiny ang coat, ibig sabihin healthy siya. Is that true?
Yes, like with people, you can tell like the classic Sunsilk commercial, no? Yung silky, very silky. So if you have a very
Yung
Plan ka pa
Silky.
talaga. Di ba
Shiny
pwedeng
Silky.
Palmolive o
Palmolive,
Pantene?
nahalata lang yung edad ko. But you'll see anybody with
G,
nice
your
hair.
hair smells terrific.
I know, may J pa.
Super
But if you
luma
see
yun.
a well-groomed, person, no, will always have shiny hair coat. No? So, di ba, mga magulang natin, brush your hair, comb your hair. Ayaw nila, dati hindi pa uso yung mga magulo. But you'll always have to comb your hair. No? So, as a sign of healthy coat always is silky. They call that silky, lustrous, parang seal. It's very smooth. Okay. Also, when you feel it, hindi siya dry. No? Hindi yung pag feel mo parang, it doesn't feel. It feels very dry. The hair is very thin. The hair has, when you touch the skin, maraming sugat. And there's a classic, very strong odor. Okay, dapat walang amoy, silky, hindi siya nangangati, and the hair should be a good texture. No? May mga dogs na makapalong ang balahibo, may mga dogs na manipis ang balahibo, may breed rin na walang balahibo. But you will see the hair, the skin and the fur should be very smooth. No odor and walang mga sugat sa balat. And also the lack of scratching.
Okay. So yung fur, parang skin din siya, no? It may be pag naglalagas o pag hindi shiny, parang baka pwede siyang konektado sa diet. May connect siya sa kinakain. Tama ba yun? To say na may connect siya sa pagkain. Pag may kinain siya na maayos, it will show in the fur.
The nutrients that we have, kasi you can eat, no? Pero it's not the right food, or it's also lacking in, they call it the fatty acids. Kasi yung balat ng tao at balat ng aso, makapal ang balat ng aso, pero manipis yung pinakamataas, they call it the epidermis. It's a very thin layer compared to humans. Kaya madaling magkaroon ng allergies or damage. Kasi manipis lang yung epidermis nila. And the shedding, also the change of skin, mas mabilis sa dog versus sa humans.
Okay.
So,
So yung shedding ng fur.
Yeah, hair and fur, because yung sa atin dito lang sa ulo, no? Sa pet is all over the body. It's like a very hairy person, no? Ang kapal-kapal ng balahibo. Okay. So here, a dog, the whole body is full of hair. Okay. So again, the health of that is related to what we eat, and also we call it the moisturizing. Kailangan moisturize yung balahibo, no? You don't have to keep shampooing, but you also need to wet it and dry it, no?
Okay. Ayun, yun ang sinabi. So, it's food, it's hygiene ng dog, how we bathe them, that we should also dry them. Ganon?
Yes.
meron
With cold
bang-
dryer, no? Some
Cold
pets
dryer.
they call that may natural, they're naturally waterproof. Mag-shake lang sila, tuyo na kagad yan.
Ayun na. Oo nga.
Yung iba, kailangan ng hair dryer. But again, if you use a hair dryer, like the poodles, the Maltese, the Shih Tzus, konti lang, you need maybe a colder setting, not the warm
Colder
setting. Kasi pag masyado mainit, natutuyo kagad yung balat.
Kawawa yung baby dog. At
Sakit
Doc,
din naman.
oo, kayo kaya tutukan naman ang ingay pa. Doc, yung edad ba, pumapangit rin talaga yung fur pag tumatanda?
Yeah, they call it the shafts become, especially if the nutrients aren't good, no? The shaft will become thinner, more brittle, because you're not getting enough. Okay, and it's usually they call it the top barrier. The top barrier, the skin. If you're not giving a good diet, the aging process will be faster. So omega fatty acids are very good, and because that will keep the integrity of the skin follicle and the skin barrier good. Okay, hindi siya ma-dehydrate, hindi siya matutuyo.
Doc, yun nga may supplement na binigay yung vet natin. Omega-3, nakalagay Coach Shine. Oo.
Yes.
Do those
Maganda
help?
yung pangalan. Yeah, any of the omega fatty acids, no, for pets are good because that will help keep the integrity of the skin barrier. You want the skin barrier healthy. Pag masyadong manipis yung balat, yung epidermis niyan, very prone to all the allergies, the
Ah,
trauma, scratching,
immune,
odor,
immune
bacteria.
system.
Yeah.
So if you
Then
have
you see
like
the hair
fur,
follicle will become thinner. At saka hindi siya
Yeah.
oh,
lustrous. Yeah.
so
So ano
damay-damay
sinasuggest
pala
nyo no?
yun. Oo, go ahead.
Ano sinasuggest yung food na nasa palengke? Not the supplement, ha? But
Mm-mm.
the things that you can buy in the grocery or in the
Salmon,
wet markets that can actually
Well,
improve the fur and the
bilis.
skin
yeah,
of your
one is commercial.
dogs and
Commercial
cats.
dog food kasi is balanced already, no? So that has all the nutrients. No? Some pets again you have to see ano ba yung need nila because some are long-haired breeds, some will need or some are allergenic, so you'll have to consult your vet about that. No? So the good thing about commercial dog food, balance na po yan eh. Okay. But others also don't like dog food or the pet doesn't like dog food, so magluluto yan. Okay. So you can also use food that is high in protein. It has also some fat. And good quality protein. Kasi pag tira ang pinapakain or bad quality protein, dyan, hindi maganda yan. I mean, pets are generally, they call it obligate carnivores, no? So they eat meat. So if you transform them into vegetarians, you might not get the same hair coat, no? But you might have to supplement it. You can have vegetarian pets, but you have to supplement. Okay? But
Okay.
generally, others will also feed fish, no? Yung iba, ayaw nila ng fish. The pet will respond bad with fish. Others, ang ganda ng balat nila sa fish. But see to it that you consult your vet because it's very important. Once you start keep changing the food, the pet becomes very picky. Nagiging masyado mapili yung pet, no? Hindi yan kakain. Mamaya, kailangan na ng sabaw, kailangan na ng mga, dyan nag-a-allergy sila kasi iba-iba yung pagkain.
Sabi ng iba pa, kalbuhin mo raw. Totoo ba yun? Yung parang para sa tao, 'di ba, kinakalbo yung pets,
Magtampo ang
kalbuhin mo
hair.
para ang tubo maganda.
Yeah, well,
May
especially the
katotohanan
chow
ba yun?
chow.
Wala.
Kasi yung chow chow, madaling magkaroon ng sugat yan because these are temperate climate breeds. No? So others will shave half of the body para mukha pa silang leon, pero the other half is free of, hindi sila nainitan. But a word of caution, no? I would recommend shaving off pag marami ng buhol. Because the fur has a protection, has a protective layer. Okay. Pag buhol yan, that means you have an underlying problem sa balat. Natatakpan lang yan. Mukhang walang problema pero sugat na yung ilalim nun.
Oh.
Merong ibang breed, pag kinalbo yan, pag na-shave, hindi tutubo yan. Ha? So,
Hindi natutubo.
yeah, they call it the Arctic breeds. No? Yung minsan, yung Siberian, yung Pomeranian, the Malamute, the hair growth, minsan, the new hair growth will not come. So, be worried, especially with Siberians, Pomeranians, Siberian, and Alaskan Malamutes, baka hindi tumubo yan.
Mga Pomeranian.
But with people, like, you want to have a haircut, but you feel cooler, you look nicer. The pet also, will feel better when it's warm. You want a shorter hair coat, no? And then grooming, you need to keep brushing them. And again, a good diet will reflect kung maganda yung hair coat nila. So, caution lang sa mga ito. Shih Tzu can grow. Okay.
Can grow, di
But
ba?
see to it also that they get good supplement, no? Because here, the strength ng Shih Tzu is all the silky long hair, no? These are they're one of the fantastic breeds that have the very silky hair coat, no? So you need to supplement. You need to moisturize.
Yung Jack Russell, Doc.
Sorry?
Pwede ko bang kalbuhin si Lily, Doc?
Yeah,
Pag
you can.
naiinitan sa summer?
Yeah, maybe not shaved all the way to the skin. You can leave some kasi parang sa blade yan, no? In the clipper may mga length, no? Half an inch, 1 inch, 1.5 inch. So you can use guards para hindi siya sa balat. Kasi pag balat, minsan nagsusugat yan. You can get...
Ayaw niya, Doc. Bumulong na sa akin, no doubt.
Ayaw
No
niya,
doubt.
Respect the pet din.
Doc, alam mo, Doc, meron na akong mga naririnig, Vinsky, na parang nagtatampo daw yung aso nung kinalbo o iniklian ang buhok. May gano'n na parang feeling niya pangit siya. May gano'n ba talaga, Doc? Or baka naman feeling lang nung pet owner?
Feeling mo lang yun.
Merong ganyan. Sabi parang nung kinalbo daw niya, parang nahihiya na yung alaga niya. Feeling niya
Parang
pangit
lang,
siya.
oo, parang.
There are pets na parang they feel naked kasi wala na
Oo.
silang yung makapal, no? Other
Oh.
pets feel, some feel like what happened to my hair because I have hair, no? I've seen pets like that, they act differently. They
Oh,
act
see?
strange, umiiwas yan, their disposition changes. I've seen also
May
other
ganun.
pets, when you shave them, they feel better because now their skin gets more attention. Kasi dati panay,
Yeah.
panay buhol yan eh. So they feel better, they feel cooler. Other pets also, when you shave them, they scratch. Kasi parang, I mean, with people who shave, no? When you shave, anything can be itchy. Like guys, when you shave your face,
Yeah.
makati yan. So when you scratch that, then you'll get wounds. Now, dogs and cats, naabutan nila yung mga genital nila, no? Or very private parts. Naabutan nila, they're sensitive. Kaya and they can reach their paws, they bite it, they can scratch their face. So mamaya pag tingin mo, panay sugat 'yan. So when a pet is newly groomed, pag bagong kalbo, see to it na may collar muna, you put a collar para hindi nila tirahin nila yung balat nila kasi they will bite their skin. Mamaya pagkita mo, panay sugat 'yan. Big wounds. Yeah.
TV.
Ayun. Alam mo, ito, how often daw ba, ayan, uulitin na lang, sorry, very basic, ano, how often daw ba dapat pinapag-groom o pinapaliguan ang inyong alaga for fur care?
Okay, for basic like with fur, no? With bath, you can bathe your pet once a week, twice a week, depending on the need, no? And also, I would recommend not using human shampoo. Though a lot of people use human shampoo, no? But the pH of the dog skin and the human skin is different. So there are pet shampoos, and I would recommend shampoo with moisturizers. So parang sa tao may moisturizer, no? You need to moisturize the skin. Not yung mga cream, no? But there is shampoo with moisturizers. So that's a very good way to keep the integrity of the shafts. Okay? Para hindi matuyo. Because too much shampooing minsan natutuyo sila. Too much blow dry can also become a problem, no? Herbal soap are fine, no? Yung iba, wisik lang, basahin mo lang sila, but you have to see to it that you dry it. Pag basa ang long hair, please dry. Kasi na either towel dry and comb, ha? Kasi kung hindi, nagbubuhol yan. Matted hair.
Okay. At tapos, Doc, yung sinasabi mo tungkol sa yung every month, sinalili may ganyan na eh. Every month, Ate B, may iniinom. Parang wala na talaga silang tick and
Yes.
fleas, ano, Doc? Forever na yun, Doc.
Well, unfortunately, because we're a tropical country, so ticks and fleas are forever. Hindi yung sa ibang bansa na may winter, natutulog yan yung mga garapata. No? Sa atin, it's like weather, pag very hot or when it starts raining, naglalabas ang garapata. And there are many pets who are not on prevention. So it's good to put them on monthly prevention. Maybe kung wala na, you can consult your vet. Is it something that I need to stop? Can I use something milder? And then they call also yung tawag dyan lifestyle. Tawag dyan lifestyle ng pet. May barkada pa siya lagi. Okay. Does he socialize with pets always? Like kunwari sa condo ka, may tambay, may playground ba sila? Do they have playmates? And then do they walk in the park? Kasi if they walk in the, kunwari sa garden, or naglalabasan sila, uuwi yan, may garapata. Okay. So if your lifestyle of the pet goes out, plays, I'll recommend, dapat monthly yan. Kasi pag uwi yan, you will never know when the ticks are, mamaya ang dami-dami sa bahay niya. And nakakamatay ang ticks, ha? Pulgas at saka garapata, nakakamatay yan. They can, we were talking about blood transfusion sa tao. Dogs will need blood transfusion dahil sa blood parasite galing sa garapata. Pag may garapata...
Doc, ano meron dun sa gamot? Di ba pinapainom sila every month? Anong meron dun na hindi sila kinakapitan? Hindi sila kakagatin ng ticks? Or kung kagatin man sila, bibitaw?
Yes. So it's absorbed and it goes to the skin and it will paralyze the parasite. So
Okay, okay.
the tick has to bite the dog. So
Yeah,
kasi
yeah.
pag uwi yan, like you walk your dog, magaling ang garapata, tatalon ka agad yan sa dog mo. Hindi mo alam. Nasa paws nila no? Kasi malapit yan sa ground. They'll walk to the back or to the neck. Dito ang una, no? Pag kumagat sila, and may gamot na yan, the tick will fall off and die. So you don't see the
Oo.
tick. You don't see the tick.
Yeah. Hindi, pero anong side effects sa pet? May side effect ba yon sa pet?
Generally, there's none. There's all medications may always have a adverse reaction. No? So
Okay.
certain because new pets and new products, they've been in the market probably 5 years or maybe 8 years. No, there have been known effects of some seizures. Okay. So it's always best to discuss this with the owner. I read about with the vet. I read about that it can cause seizures. If any pet has signs of epilepsy or yung linya niya, yung pamilya niya may epilepsy, huwag niyang gamitin yan kasi baka magkaroon. In my practice, I've seen probably only one case na nagkaroon ng seizure. And we report this right away to the drug company because they call that regulation. No? So kailangan report that there was a adverse reaction and then it's part of they call it the field trials. No? Because pag marami yan, that is pulled out to the market. Right now, it's eight years already. So they're safe. I use it on my pets. I was also cautious about it. But it's good to know always as an owner, what are the possible side effects. So it's a good question. No? Kasi nababasa yan pag Google mo. Ayoko na. And then you won't use tick products. Then the pet dies kasi ang daming karapata.
Ako naman so far so good.
Garlic, pero I don't find that effective. No?
Oo.
Bibi.
Yung iba nilalagyan ng ano ba yun? Apple cider.
Cacao.
Apple cider.
Okay.
Oo, effective daw yun. But anyway, ako naman yung dipatak naman sa batok. Doc, so
There is
maliban doon sa garapata, yung galis po ba detrimental rin sa health ng ating fur babies? Pwede ba silang mamatay doon?
Okay. There's another condition called mites. No? Mites, hindi nakita yan. They go under the skin. So there is they call it demodex mite. Hindi mo nakita yan, pero nakakalbo yan. Tapos ang baho-baho ng pet kasi it destroys the glands, no? The oil glands. No? The other one is the scabies. Scabies, yan yung galis aso. That became the galis. Okay? Because that one, maliliit lang yan. Dogs and cats get it, mamaya yung tao. So once a pet gets that, it's very itchy, it's very smelly, nagsusugat sila. So again, there are many causes of wounds. No? Yung tawag dyan, irritations can be parasites, pwedeng fungus, pwedeng mites, pwedeng diet, pwedeng hormonal. There might be a hormonal problem. There might be also bacterial problem or autoimmune. No? Maraming conditions. No? You can always self-medicate using like mga bayabas, or betadine. These are the very effective home remedies. But sometimes, most of the time, you will need supervision and consultations from a veterinarian para malaman natin ano ba yung problema para diretso lang. A lot of pets now are getting allergies. Sobrang daming allergy. So there are always certain breeds na sa lahi na nila. Pag 2-3 years old, kamot ng kamot yan. Non-stop yan. So veterinarians can help you there. There are friends to help you. Kasi the discomfort is there. You look at the comfort, the pain. May pain ba yung pet? Kasi ako nasasaktan pag nakita ko. May sugat, may amoy, kamot ng kamot. Masaya ba yung pet? Ako hindi masaya.
Yeah. Doc, yung sa cats lang, kasi may mga nakamonitor din sa atin na cats naman po yung alaga. Ano po? Generally kasi yung cats, nagdidila, di ba? Dinidilaan nila yung kanilang fur. Ano po? Pero sila, kailangan din ba sila iligo ng once a week or once a month? O hindi, hayaan mo yung pusa, malinis talaga yan by nature.
Yeah, cats are actually one of the cleanest pets, no? Kasi they keep lick. Yeah, and their tongues are like sandpaper, no? So they keep licking. Yeah. A cat that does not groom, pag hindi siya nagdidila, may sakit yan. Okay. So makita mo yung cat na panay, kasi yung balahibo ng cat nagmamatrin, ha? Sign yan ng disease. So may sakit yan. So, a cat na pangit ng balahibo, tapos nagdidikit-dikit, ibig sabihin hindi siya nag-groom. So yes, a cat will probably need less baths than a human, than a pet.
Than a dog.
Depende rin, kasi some cats sleep with the owner. So if the cat sleep with the owner, of course you don't want a stinky cat, no? Or yung may mat, no? But generally, cats need less because they have the mechanism of licking. You have to supplement them because they cannot produce certain amino acids for the skin. For a nice healthy cat, you have to supplement them with omega fatty acids. No? And also, moisturizer shampoos for pets is very good. No?
Okay.
But cats
Yung
are
conditioner. Oo.
generally also cats don't like to be bathed. No, you have to train them. No, dapat masanay.
Ayaw.
Yeah.
Ayaw.
So
Oo.
again,
At saka yung
like,
cats, Doc, yung cats wala namang garapata, di ba? Nasa aso yung garapata. O pwede ba lumipat yung garapata ng aso sa pusa? O hindi nila type yung host na yun?
the tick is usually a dog specific tick, no? They call it the Rhizocephalus sanguineus. That's the brown dog tick.
Yeah,
Pero kumakapit rin sa tao yan. But when they know it's
Hindi sa
not a
pusa.
dog, I've seen pictures in other countries, yung pusa, panay garapata. So go,
Oh my God.
But they're in other countries, especially the Mediterranean countries, Italy, Greece. I've seen cats panay garapata. Like, I didn't know that. So yeah, it can. Generally, it's a dog specific. But I was bitten by a tick before. Akala ko, sakit. Pagtingin ko may garapata, nakadikit. And you can get also parasites you can get sick also from tick, no? They call it Tick-Borne Fever. So Lyme's disease, and if you read it in North America, that's from the tick of the deer. So pag yung karapatan ng deer kumagat ng tao, magkakaroon ng sakit ng tao, the person can die if you're not diagnosed.
Oh my.
So here also they test you also for blood parasites, no? From ticks. So certain times you have high fever. If you have a pet, they will call infectious disease might ask you to have tests for Ehrlichia, which is a blood parasite.
Doc, pasensya na din, isisingit ko lang, alam ko,
singit mo,
overtime na. Pero
059.
paano yung sobrang balbon naman na pusa, paano alagaan yun?
Okay, yeah, they need a lot of brushing. Brush yan, ha? Comb and brush. Okay? Because makapal ang balahibo nila. But cats love to be groomed. So sanayin mo pagkuting because when they start they love here, they love in the back. Certain cats hate it, no? So sanayin mo pagbata pa sila. And then again, the diet is the key. You have to have very good balanced diet. And if it's not, you have dull skin already, that means the diet is lacking. It's not the right diet. And supplement with omega fatty acids. With cats, para silky. Kasi they can fly, But the beautiful cat has a lot of full coat. That's nutrition. Good nutrition.
Okay.
Okay.
Thank you. Lili, magbababay na tayo kay Doc. Kumarap ka doon. Napakabastos mo talaga. Nakatalikod. Bye-bye, Doc.
Bye, Doc Unson. Thank you so much.
Thank you, Doc.
Thank you. Okay, thank you.
Salamat si Dr.
Bye.
Ed Unson ng The Animal
House. The Animal House at Jupiter.
The Animal House.
Napakalaking. May emergency room.
Hindi pa ako nakapunta. Sobrang laki ba, Tibi?
Ang ganda. Nakakatuwa kasi may emergency room talaga sila para sa mga pets. 24/7.
Kasi parang ospital. Parang ospital talaga.
Oo, daming doktor.
Hindi pa ako nakapunta.
Nakakatuwa.
Yung dito kasi sa Del Monte, yung pinupuntahan ko sina Dr. Ke, hindi na siya ganun kalaki. Malaki din, pero hindi super laki na parang ospital. Parang clinic lang talaga. Yung sa Makati, super laki.
Oo, tsaka madaming doktor. Kaya maganda rin. Lalo na pag may emergency kayong case, pumunta kayo.
Doon.
Importante kasi matingnan agad, lalo na pag emergency. Ayan, meron naman pong Animal House.
Hanapin yun si Dr. Ed. Kaya lang mukhang bisi-bisiyan yung lolo
Busy
nyo kasi siya may ari eh.
Oo.
Kaya, kumbaga, by appointment talaga yung lolo mo. Siya may pinakamarami siguro partner, pinaka-trusted doon, kasi siya nauna eh.
Senior eh. Pero hindi naman halatang senior. Pero senior vet siya
Thank you,
doon.
Dr. Ed.
Bye, Doc
Paano?
Ed, thank
Paalam
you.
na tayo, partner, ha? Maraming salamat po, ha? Sana may natutunan po kayo sa 2 episodes po natin na taped. Thank you, Kasama si Lily, si Alvin po ito.
At ako po yung Ate B, Bernadette Sembrano-Aguinaldo. Please like, share. Yun ang pinaka-importante. Share this episode sa inyong mga mahal sa buhay. Na mga may pets din, ano? Ayan, dahil sabi nga natin, ng ating kalusugan ay nasa ating mga kamay. Until next time, ako po yung Ate B, dito pa rin sa...
Thank you.